thank you very much for joining us for today's episode of School Board U, Lunch Breaks. As you know, we're talking about COVID-19 updates, and we have many guests joining us from the Department of Health, which we're really excited about. These people really know their stuff. Those of you who have already had your regional meetings and have been able to watch their video, this is a follow-up to that. For those whose regional meetings are coming, I'll just give you 1 second of introduction. Some of these participants had pre-recorded a video which we're showing at the regional meetings. We're about halfway through those meetings right now. The rest will be finishing up by the end of next week. And they've given us in the video sort of the standards of how the Department of Health is working with the schools and the Agency of Education to both prevent and work on outreach in the event of COVID outbreaks at the schools, as well as some details about the contact tracing program and how that's working and intended to work through the schools. So this is our list of panelists, but rather than tell you who they are, let's see if we can't introduce you to them. Can everybody see the video? Somebody want to acknowledge that you're seeing this? Okay, good. Excellent. So in no particular order except the way I have them listed. First of all, you should know me by now, but you may not all know my face. I'm Susan Holson, Director of Education Services at VSBA. You probably know my voice from the past webinars. I'm joined today by an illustrious list of guests. We've got Alyssa Stahlberg, who is the Maternity and Child Health Director at the Department of Health. Do I have that correct? I'm trying to interpret some of the alphabet soup with your names. She's also the COVID School Child Care Branch Co-Director and COVID Epi Operations Co-Lead. Jennifer Pistole is not on video, but she's here with us. She is a public health analyst and the primary prevention team lead for the COVID-19 response. Jennifer DiPolito, did I say your name right? Sort of, close enough, okay, is the COVID-19 core epidemiologist team co-lead. Julia Pringle is the EIS officer, and she'll tell us what that means, I hope, and also the COVID outbreak prevention and response co-lead. She's joined by Kimberly Perez, who is the COVID-19 core, I have trouble with this word, epidemiologist team co-lead, and Julie Corwin is the COVID communications and emergency response person from the Vermont Department of Health. And I don't know if Veronica is on the call right now, but she is.
Everybody. Hi.
Oh, okay, thank you. You're hiding behind my panel here. Veronica Fielkowski, how'd I do with that name? Okay.
Perfect. Yeah.
Yay.
People added T's and R's to it, so that was great.
Now maybe I can actually pronounce epidemiologist. She's the surveillance epidemiologist and COVID data lead, also at the Vermont Department of Health.
So again, I'm Elisa Stahlberg. I am the Maternal and Child Health Director at the Health Department, and also leading up the branch related to schools and childcare for the COVID response. You'll see a number of us here today and presenting before you and here to answer questions, and we represent a number of different teams within this response. There are several hundred health department employees working on behalf of the response, and we just are a small fraction, and we work as a really close team. And many of us did not know each other before 7 months ago, so it's been a very exciting and interesting experience for sure. So we are really hoping just to give you a brief few slides and kind of a window into the work that we're doing on behalf of schools, and then leave a lot of time to answer your questions. Susan, if you could go to the next slide. Awesome. So this is a slide that we have in all of our presentations in maternal and child health, really to thank you for all of the work that you're doing in your own districts and communities in support of children and families, because this is a huge effort and complex in uncertain times and requires every ounce of human power that we have to do this with. So thank you. Next. And also a disclaimer that the COVID-19 situation is evolving extremely rapidly. So any information that we give to you today is what we know right now and could change as soon as this afternoon. So just keep that in mind as we talk with you. Next. And I'm going to share this slide, which I'm sure you all know because you are so involved in your schools and communities now. But we at the health department really do believe that it is critical to open childcare and schools because it's important to all of these things, to learning, social emotional well-being, connection, access to food, supports for children and youth in difficult home situations, physical activity. That's not all of them, but that's many of them. And so that's why we're all working so hard, and while you are all working so hard to open schools and provide this important resource for children and families. Next. These, I'm not going to read these for those of you who have seen the Strong and Healthy Start guidance. These are the objectives that guided many of the recommendations and the decisions that were in the guidance. And really it is about making sure that we keep COVID or coronavirus out of the school, and then helping to decrease transmission if it gets there, and also making sure that students and staff and families have what they need, both with regard to resources and communication and supports. And that it's an equitable educational experience for all students. Next. Here is the membership of the Safe and Healthy Schools Task Force. This is the group of esteemed medical and educational experts who were involved in the development of the guidance and continue to support revisions, including we are convening right now as we are here this week and next week to reopen the guidance and consider if there are any revisions that need to happen. Next. And just a preview into what's to come. So as I just said, we are reopening the guidance. Pretty much since the day that we released it, we've been gathering feedback and input on what works and doesn't work in the guidance. We have a team at the health department who answers questions from schools and childcare administrators all day, every day about the guidance and how to set up their schools so that they can meet the guidance, and lots of questions that aren't in the guidance. And so many of those calls lead to future revisions of the guidance, and then the Secretary of Education also has an advisory council, and so topics come to him and also to the Agency of Education for things that need to be further addressed. I don't know what the final decisions will be on these topics. However, these are the things that we are discussing currently. There's been a ton of conversation about winter weather because all of the guidance was set up when it was still warm out, and turns out infrared thermometers don't work in cold weather. And what are we going to do about open bus windows when it's snowing and below zero? And there's just numerous questions and concerns that have come in around PE and music and driver's ed, field trips, travel. There's lots and lots of questions that are coming in right now about supporting travel in a way that is healthy and safe and keeps coronavirus out of the schools upon people's return from travel. So much more to come. We, as I said, we're meeting this week and next. I anticipate probably a new guidance document will come out mid-October, although don't quote me because I've gotten that wrong before. So, but we're excited to sort of keep up with the science and keep up with the emerging situations that are happening in Vermont. Next. And I'm going to pass it off to Jen Pistole to talk about some of our additional materials and supports that we've developed for schools.
Hi, everyone. This is Jen Pistole. I am one of the leads for the primary prevention team, and our team works with groups and facilities, and we help them prepare prior to any COVID cases being identified there. We also work to find ways of sharing information, whether that's webinars or phone meetings, or also putting together guidance or informational documents. So I quickly wanted to go through 3 of the documents that I think would be very helpful that we've worked with the help of many others on. And the first is the how pre-K to 12 schools can prepare for COVID-19 cases in their school. And this document really provides question prompts followed by information to help schools think about how they can incorporate the various aspects of preparedness plans specific to their school. The next is the pre-K to 12 school COVID-19 case actions checklist, and this provides a general list of what to expect and action to take when a student or staff member becomes symptomatic at a school or when someone was in your school while infectious with COVID-19. And the other one is the COVID-19 quick reference guide, and this is a one-page document that really provides easy to understand and basic information for schools if someone was in their school while infectious. And all of these documents and more can be found on the schools, colleges, and child care programs website, which we are continually updating and creating new documents to put on there.
Jen, this is Susan. If I can interrupt you for just a moment, sorry. I just want to let everybody on the call know that we have linked from the VSBA COVID-19 page on our website to that main health department page for schools under Department of Health Resources. So you can get there very easily from our VSBA site. Sorry about the interruption.
Hi there, my name is Jennifer DiPolito. I am one of 4 co-leads on the contact tracing team. We have anywhere from 30 to 50 contact tracers on our team working to keep Vermonters healthy and safe, and they do an incredible job. So I just want to highlight, as schools are opening up, we are constantly evolving our protocol and how we handle each situation, and each situation is different. So what I want to highlight is that if we determine through our protocols that someone was in school or at a school event, like a soccer practice, while they were in their infectious period, so they test positive. So we define infectious period as 2 days before they experience symptoms, or if they are not experiencing symptoms, that would be 2 days prior to getting their test. If we, the team, determine that they've been in school while infectious, we will work closely with the schools throughout the contact tracing process, myself and my team, and then also the outbreak prevention and response team, who is Julia and Kim on this call. We all work very closely with the schools to determine who's a close contact of the case, who needs to be in quarantine, and any other steps the schools will need to follow as we conduct contact tracing. So we do have a lot of back and forth with the schools. We reach out to the positive case within 24 hours of receiving their positive test. And from there, we will work with the schools to reach out to their contacts. So even though we do start the process within 24 hours, it is an ongoing process from there. So we highly value your partnership, the VSBA partnership with us and the communities, to make sure that we can reach people as quickly as possible.
Hi, everyone. My name's Julia. I'm here with Kim. We represent the Outbreak Prevention and Response Team, which we call OPR for short. And Jen did a great job setting us up. We're kind of going through this presentation in the order of teams that you might interact with if you have cases in your school. So like Jen said, if you have somebody who was infectious while they were in school, you'll definitely be hearing from contact tracing team, and you'll also be hearing from our team. Together, our teams work together to assess the risk to your school and work with you to make decisions about things like school closure and also any other transmission mitigation steps that we think could help your community stay safe. We put together this slide to list some of the factors that might go into a decision about whether to close, because we know that this is a really important topic to you. And I think I want to go back to something that Elisa said earlier at the beginning, that this is an evolving situation. We are learning more and more about this virus every day. And so while some of the information that goes into our risk assessment is going to change as we get more clear data and can more precisely pinpoint who's at elevated risk, the overall framework for how our teams are going to work with you is going to remain consistent. So if you have a case in your school, we will be there to help support your decision making and work with you to figure out who these close contacts are, even as the science evolves. But there's a couple things that I just want to highlight about how we might make a decision jointly with a school, of course, about when closure might be merited. And there's a few things that go into this. The first is timing. Let's say we learn about somebody who was infectious at a school on a Saturday afternoon, and we have Saturday and Sunday to assess the risk and figure out who's a close contact and make notifications to those individuals who need to quarantine. Everything might be in place and ready to go for you to open business as usual on Monday morning. That situation is really different if we learn about someone who is infectious in school on a Wednesday night at 9 p.m. and you're planning on opening the next day. In a situation like that, even if later we realize that there wasn't a lot of risk to your school, we might encourage you to think about going to remote learning for one day while we conduct our risk assessment, just to make sure nobody's there who should be in quarantine. So timing is a really key piece of this. And like Jen said, our contact tracers do an excellent job of timeliness. And we will work with you as quickly as we can to get all of the close contacts notified. But sometimes just based on when people get tested and we hear about things, it might make sense, even if the school has done everything correctly, to just pump the brakes for a second and let us all gather our thoughts and facts on the investigation before reopening. There's also a couple other factors from the health perspective that go into decisions about remote learning beyond that initial investigation time period. And factors like, the size of the classes, whether their students potted in a class for the entire day, how many opportunities there were for individuals to be mixing, whether the infectious person was there for 1 day or 5 days during their infectious period, whether there's a lot of ongoing transmission in the community, types of extracurricular activities that the student was participating in. All of those things are going to influence the scope of how many people might be asked to quarantine. And sometimes we might be looking at 1 or 2 close contacts. Sometimes, even if a school has done everything correctly, if it's a pod of students who've really been together for an entire day with an infectious person, we might be looking at asking that whole class to quarantine. And so those factors are certainly going to contribute to the school's operational perspective, things like staff shortages, things like, is the entire grade effectively being asked to quarantine? Particularly in small schools, sometimes that pod might be the entire grade, and sometimes a school might decide, based on health's recommendation, that it makes more sense to go remotely while so many students are affected. And so we really see this decision-making process as drawing on our contact tracing investigation and our conversations with the school, but also acknowledging these other variables that schools are experiencing from an operational perspective. So we will work with you to provide our recommendations and our judgment of the risk to your school, but we'll also look for the school's perspective on operation strategies and jointly come to this decision-making process. I've also added a link on here because CDC has some really great indicators of like different types of school structures and which ones are might introduce more risk and lower risk. And I think it does a really nice job of walking through the fact that there is some nuance and case-by-case basis here based on many factors like classroom size and community level transmission. And we let all of those factors go into our decisions on school closures. And that's it for me. You can go to the next slide.
Okay, so I guess it's time to turn this over to questions and answers. Is that your last slide, ladies?
Yes.
Okay. Okay, so I'm going to stop the screen sharing and I'm going to turn off my video because you don't need to see me. And we now have the presenters, the health department partners here to answer your questions. So you can raise your hand, you can hit the question box, or you can type your questions in. I'm just wondering if I'm not able to identify from looking at the list of attendees whether any of the board members on the call have had either neighborhood or community or school incidents with the virus that may be particularly in the forefront of your minds right now, but we would certainly love to and encourage you to ask any questions that you may have, both general and even more specific if they surface.
I would maybe just chime in there, Susan, if you don't mind. And while we do really want to be able to answer like questions that you have about specific hypotheticals, we really don't encourage sharing any type of information that could be identifiable either to individuals or to schools. So, you know, if you are a school that has had a case and wants to debrief with us one-on-one, we can certainly facilitate that, but we would encourage this forum to really try to protect privacy of schools and people as much as we can. But we're happy to walk through hypotheticals with anyone.
Thank you for that clarification. Absolutely, privacy is important. Okay, so we do have a question. The guidelines treat 6th grade different from 5th grade, which is a complicating factor for the K-6 schools. Is there any consideration being given to allowing K-6 to use the K-5 guidelines?
So this is Elisa. We had this very same conversation earlier in the week as we reopened the guidance, and that is certainly a topic that is being discussed. And I don't know what the final decision will be, but the medical and educational experts on the task force all felt very comfortable with the idea of expanding to K-6.
Thank you. And you said that you are guessing that new guidance may be out as early as a couple of weeks?
Yes, although I will, if there are some significant changes coming that we can anticipate, I think I would probably try and push to at least make an announcement that those are coming even before the guidance is released, but I can't guarantee that.
Okay. I also am aware that at the governor's media briefings, there's been a pretty strong statement repeated that, as far as I'm aware, there have been no known cases of spread in the schools at this point. Is that accurate? Am I getting to a sensitive situation that you're not comfortable answering?
I don't think so. I might look to Veronica to confirm that, but
not in the school settings from questions since the fall. Well, I think even beforehand, there has not been transmission identified within
You're cutting in and out of the audio a little bit, but I think what I heard you say is that there's not been any confirmed transmission within the schools. Is that correct? Okay, thank you.
Yes, sorry. I think my audio doesn't like the go-to webinar. Sorry.
Not a problem. Here's another question from a board member. As you consider risk, is there much difference in how you respond to elementary or high school populations?
There is, to some degree, and in some ways that has to do with the way those types of schools are often structuring their classes. And so our experience is typically that a lot of elementary schools seem to be like podding students throughout the day, whereas sometimes high schools or like, you know, older students are moving through like classrooms throughout the day. So typically, like CDC tells us that a close contact is someone who spends within 6 feet of an infectious person for greater than 15 minutes. However, CDC also acknowledges that the more time you spend in a space with somebody, the more likely your risk is going to increase. And so when students are podded through in a classroom for the entire day, even if they aren't meeting that within 6 feet for 15 minutes definition, it's likely that we would ask that classroom to quarantine just because we know that there is heightened risk from sharing that like closed space for a whole day. And then in high school situations where people aren't sharing that space for an entire day, but instead like having these 1 hour blocks together, in situations like that, we're most likely going to rely on our close contact definition, which again goes back to the within 6 feet for 15 minutes definition. So yes, it is a little bit different. It's less so specifically about the age of the student and more about the like exposure scenario, if that makes sense.
And here's another question. How quickly are test results being returned to you? And how readily are you able to retest to check again for false positives, which seem to be a reality? And this person adds, far better than false negatives.
Our turnaround time, and I'm sorry if my audio keeps cutting out, I can type it in. Our turnaround time for most labs has been an average of 1 to 2 days, depending on the lab. And that's turnaround time to reporting to the health department. Oftentimes the provider will have received that result earlier and conveyed it to their patient. And then I'm not sure who best to answer the false positive question.
So I will say there are a couple different types of tests out there, and I think this might be part of what's motivating the question. When we have a PCR result, if it's positive and then we're going to like act on that result and treat it as a true positive. The test is like highly accurate. There is another type of test called an antigen test, and these tests sometimes we might follow up on a positive result with additional PCR. And that's because the test is really indicated for people who are symptomatic or we have a reason to believe that they like have some sort of exposure. So antigen testing is really for people who are symptomatic, who are living in really high transmission areas, who might have had exposure to someone who is a confirmed case. In settings like that, you know, an antigen positive result, we really are going to treat as a true positive. Sometimes if that criteria isn't met, we might start acting under the assumption that it is a true positive, but in the meantime, we would request that that person go get a PCR test for confirmation. And so then if that PCR test affirms that this person is positive, we would keep the public health recommendations that we had already started. But sometimes if that PCR test is negative, we would realize that in that situation, it was a false positive. So that is a little bit nuanced. But in general, like if we have a positive result, we're going to start acting on it, even in these rare situations where we might have to seek additional confirmatory evidence in the meantime.
So this is a follow-up to the earlier question about students at different ages and stages. Are high school age students considered more susceptible than elementary school?
I don't know if someone else wants to chime in too, but my understanding is no. I mean, there is this is an evolving topic that's being looked at. I know that there is some data out there that's suggesting that younger students aren't transmitting quite as much, but to my knowledge, we aren't in our contact tracing protocols making any sort of assumption about biological susceptibility by age. Is that true, Jen?
Yeah, that's correct. Thanks, Julia.
And that actually leads me to a concern that I've been having. We're seeing so much discrepancy at the federal level about some information and some of the communications from the CDC, for example. And so I know you're relying on guidance and data from the CDC, and I guess my concern is it reliable? Anybody want to touch that one, or should we leave that in the parking lot?
So I'll say that, well, Veronica, were you going to start?
I can just say that, yes, we do follow federal guidelines, but when we have unique situations to Vermont, we do look at our own data and make recommendations that are specific to Vermont. So I think that there's a fine balance between kind of getting at your question, when we're seeing something different here, we are looking at our own situation, providing, using subject matter expertise from our own groups to come up with Vermont specific guidance.
I agree, and I just echo what Veronica was saying. We do have a lot of Vermont-specific policies. Many of our policies are rooted in CDC guidance, and those documents are often very well researched and thoroughly cited, and generally really reliable. But if there's ever something that we feel unclear about, or we're worried about, or we disagree with, or we think doesn't really pertain to the unique population of Vermont, we do have the authority to set our own Vermont guidance. And I think that's really reflected in all of the great work that went into the school reopening guidance. Thinking back to that slide that Elisa showed in the very beginning about all of the partners and stakeholders who convened to come up with the Safe and Healthy Start guidance, you'll notice that many of them were Vermont specific, local stakeholders. And so our school guidance really does reflect our local knowledge and unique structure.
We've recently moved to what the Agency of Education defines as stage 3, and that opened up high school sports. Winter sports, of course, are played indoors. Are there concerns about that?
I can, and this is Elisa, I can answer that question. That I know that there's currently a separate work group that is working on the winter sports guidance, and that I think is also anticipated to come out this month as well. And I think they're in part waiting to see what happens with the school guidance, so that those two sets of guidances can sync. But I think there's valid concern about all sorts of things related to winter weather and people being in closer confined situations, as well as the higher risk of flu and colds.
One thing that came up a couple of times during our recent regional meetings has to do with air quality. And ironically, the couple of times that it's come up, the issues were not identified as a result of preparing to reopen schools in light of the pandemic, but rather there were other air quality issues at play in these schools. But it did raise the question, as some schools are considering investing in filtration systems and other ways of assuring the quality of the air in the buildings, as we're learning more and more about airborne transmission. But there doesn't seem to be a standard as to what the air quality should be, or how many particles per whatever. I'm certainly not a scientist, but does that exist somewhere? Is there knowledge about that that's just not been incorporated? And do you anticipate that it will be incorporated in the winter guidance for the schools?
We do have a team currently reviewing the guidance, particularly, we have lots of teams reviewing the guidance, but our environmental health section is currently looking at the heating ventilation section of the guidance. So I anticipate it will be updated, but I am certainly not an expert or even a novice at those topics, so I don't want to speak to them. And I also know that that the Agency of Education also released some additional guidance around HVAC. I don't know if that's been reviewed by your membership, but I would encourage you to look at that. But we certainly are looking at the HVAC issues for sure, and hope to have some more clarifying guidance in the next version.
Yeah, and I would also add to that, I believe it's Efficiency Vermont has some grants available to schools to bring in like the actual experts, like industrial hygienists in these fields, to talk about these things. And I believe we linked to some of this in our guidance. And then I would also add, like, this is one of those areas where we're at the forefront of our knowledge on the relationship between transmission risk and HVAC systems. So in general, there is consensus in the science that increasing like airflow, particularly outside airflow, helps. And that's why in a lot of our guidance, we say things like open windows. But a lot of the nitty-gritty details around like airborne transmission and all of these other things are still being worked out in the science. So some things we just don't know yet. But I would encourage schools who are interested to look into that Efficiency Vermont resource. And also, I think VOSHA has some good things on their website as well.
That's great. Thank you for those suggestions. Thank you from VSBA. Thank you from schools. Thank you all for the work that you're doing, and for sharing it with us and partnering with us in this effort to keep our membership informed. If additional questions come in over the next day or so, I hope it's okay if I shoot you an email and pose those to you. I know that you've made yourselves available to the school districts and have been working closely with administration, which of course is appropriate because they're the ones who are really at the at the starting line of all of this, with respect to the school districts and the buildings and how this is being managed. But school boards certainly are confronted with issues like needing to invest in infrastructure in the buildings and making sure that kids stay safe. I know at the end of the day, that's everybody's mission. So thank you all very much for joining us. And that goes both for our school board members who are on the call and also our guests from the Department of Health. I just want to reiterate that when we end here, we will have a very quick survey that we would appreciate your feedback on how this resonates for you and whether this topic was meaningful and what we can be doing better to serve your needs as school board members. So thank you all. I hope you enjoy the rest of this. I think it's going to be a beautiful day. Keep those windows open and we'll be in touch.